So only women getting eye lifts? Absolutely not. So I like to state in my practice, up to 40 to 50% of my patients are males that desire to have eyelid surgery. Heavy lids, low set brows, fat pockets, crepey skin are all common complaints that my male patients want improved. And they still want to maintain looking as young as they feel. My male patients desire a very natural look, a look that still instills their masculinity. They see my before and afters and see the results that my patients have, and that's what caused me to develop my natural looking blepharoplasty. Men's lids need a different playbook. When I address and evaluate the patients from the forehead, eyebrow, upper lid to lower lid, I evaluate how the changes have happened with aging. Most men usually have a lateral brow ptosis. There's limitations to an endoscopic brow lift in most of my male patients because most male patients have very high hairlines. The longer the distance between my incisions and the brow is not ideal for a true solid lift, and so the results are often very limited. The third is the result, the shape I see from an endoscopic brow lift does not usually fit the male issue that happens with aging. So usually a direct lateral brow lift is an answer that I like to provide for my patients that have that low set brow. Second is the upper lid portion, the blepharoplasty. So it's important for my patients, my male patients, to not have too much skin removed. I do not remove any muscle. I also am very careful in removing the fat, and that way the patients still have a resounding, beautiful amount of volume still left in the upper eyelid without having them look sculpted or too sculpted, without having them look too overdone, and that's very key. Using my patients' old photographs is really important. Oftentimes patients have always had a lateral tail of a descent from their brows, and so we leave that. We don't want to change that if the patient doesn't want. We just focus primarily on removing some amount of skin in the upper eyelids. Lower lids, it's really important to not change the position or structure of the lower lids. We're just trying to efface that prolapsed fat. We're trying to improve the hollowing. We're trying to improve the skin texture. What I'm doing is avoiding changing the eyelid structure while doing all these procedures. So it's really important to maintain that natural look. When it comes to male blepharoplasty, it's important to choose a board-certified oculoplastic surgeon that has extensive experience in cosmetic eyelid surgery. Got questions? Drop them below and I'll answer them personally. And hit follow to catch next week's myth.